Good morning. Thank you, Michele, Giovanni, and Massimo, for your invitation. I am very happy to be here and to be able to participate in this project. I am Gabriele Cervino from the University of Messina, and my topic is the optimization in digital panoramic radiographs, a new software PACE. I will try to make a brief summary of all our diagnostic aspects and stage of communication with the patients through the processing software that we will see will allow us to improve the diagnosis in the dental field. The first dental X-ray followed by a few weeks the discovery of X-ray in 1895 and was carried out by Dr. Wolkoff on himself with an exposure time to radiation on 25 minutes. Extraoral techniques are essentially represented by panoramic dental radiography, introduced by Patero in 1950. Dental radiography is one of the most important tools available to the dentist. Many dentists are familiar with intraoral radiographic techniques, but are still unsure as to the interpretation of these films. A knowledge of normal radiographic anatomy is essential to correct diagnosis of disease and for monitoring disease progression. Moreover, many dental procedures can be performed only under radiographic control, and checking adequacy of procedure and outcome of treatment also heavily relies on radiography. Pathological radiographic changes are usually discrete, and therefore clarity and detail are essential. For dental radiography to be used for diagnostic purposes, it should be an accurate representation of the size and the shape of the tooth, without superimposition of adjacent structures. All normal anatomical landmarks are by no means demonstrable in any given radiography. In fact, some are visualized in a small percentage of cases only. However, the dentist should be familiar with them so they can be identified and correctly interpreted when they are visualized. There are also wide structural variations that are with normal limits. This is well exemplified by the trabecular structure of bone, which presents a variable picture depending on the size of the bone, size of its medullary space, and the thickness of its cortex. The pattern also varies with use, disuse, and the age of the patients. With disuse and advanced age, the trabeculation tend to become fairer and finer in structure. Digital radiology established in dentistry during the 1980s is no other way considered to be as good as conventional film. In 2007, the ERCP updated the radiation and the tissue weighting factor for brain tissue, salivary glands, oral mucosa, and the extrathoracic airways, based on the latest available scientific information. The risk-based study by Ludlow et al. Recommend further reducing X-ray usage in the head and neck area. The reduction of the dosage for digital compared to film-based radiology is generally accepted. Besides the well-described advantages and achievement of digital radiology, the FISR publication, Managing Patient Dose in Digital Radiology, cautions against the risks of excessive use of X-ray due to the digital techniques. Fast and easy image generation may lead to a relatively unnoticed increase of radiographs. The dose reduction of digital systems might be decreased by additional radiographs and incorrect exposure parameters. Even within the film-based system, dose reduction up to 50% are achievable by using high-speed films and radiation protection measures. Technological progress in the last decades has represented an important evolution also for radiology. The term radiology itself has now changed into diagnostic imaging, and instead of traditional radiology image, we increasingly speak of the digital image. The traditional system, which involved the use of film and development with chemical liquids, are being replaced with the use of computer diagnostics. The transition from traditional to digital radiology keeps the source of exposure and the final result as fixed element. What changes and is renewed is the intermediate process consisting of acquisition, processing, and reproduction. In recent years, digital imaging has undergone a continuous evolution that has led to increasing precise images that can compete with traditional ones. In analog radiography, the detector of the signal coming from the patients is also the support on which the image is formed directly and that allows its visualization. So the film acts both as a detector and as a means of visualization, responding to the exposure only in a certain energy range and according to a unique and definite conversion curve. In the case of digital systems, instead, the radiology film is replaced by a digital sensor or a recording screen. And unlike the traditional system, the contrast can be modified at will to be adapted to different diagnostic needs. For its operational and technological characteristic, digital radiology has several advantages. It allows to reduce the dose of exposure to the patient by 50% without sacrificing the diagnostic quality of the image. It allows to avoid overexposures as any errors are immediately detected. In the latter case, with traditional system, there is an excessive blackening of the film and a consequent loss of clinical information. In digital imaging instead, the image remains almost uncharged and slightly clearer. In the opposite case of underexposure, in the analog system, you will have a radiogram of low optical intensity, and in any case, not useful for the clinical study. In the digital system, the image will be darker, but will not lose anatomical details. The role of panoramic radiography has become a commonly used imaging modality in dental practice and can be a valuable diagnostic tool in the dentist's armamentarium. It is necessary for making preliminary diagnosis and be able to develop treatment plans. True, if we can make diagnosis of caries, periodontal disease, screening, the orthodontic treatment, oral pathology, impacted wisdom teeth, mandible fracture. For example, asymptomatic impacted first molars are often detected incidentally on panoramic radiographs taken routinely during the planning of general dental treatment. X-ray diagnostic allow for a proper diagnosis to be made and the treatment course to be determined. The most common use to diagnose the presence of an impacted third molar is panoramic radiography. After having focused on the above mentioned points, why then use the software PACE? Because the contrast and detail enhancement of panoramic radiographs helps dentists to better evaluate the anatomical structures of the teeth present in the image using less radiation dose. For this reason, an algorithm for contrast and detail improvement of panoramic dental radiographs is presented in this project. In addition, the help of dental specialists in the qualification of the results obtained by the algorithm is highlighted. The visual results obtained by the algorithm were clinically evaluated by expert dentists. In general, according to the evaluation, the PACE software was better at enhancing the visual quality of panoramic dental radiographs. As future works, quantitative evaluation of the improvement made to the images by areas of interest can be performed. In addition, this software can be used as a pre-processing of other applications for automatic detection of pathologies affecting bones, cysts, tumors, or resorption and caries of teeth. Thank you, everyone. A good day.